Hello, everybody. Dr. F. Scott Field here, and I'd like to introduce you to our newest sponsor. The NPTE Final Frontier is the review course that I wish was around when I took the board exam. For those of you who know my story, it took me a handful of times to pass that exam, and quite frankly, I really wish I had an exam review course around, just like the NPTE Final Frontier. Check out their website, npteff.com, and use the code HET at checkout for 10% off to all of our listeners and fans. Hello, everybody, and welcome to another Teach Me Something Tuesday episode of the Healthcare Education Transformation Podcast. I'm your host, Dr. F. Scott Field, and today's topic is all about reflection. Anytime a year ends or a year begins, it's always a good time to reflect and think about all the things that you've accomplished over the year, what things really went well, what things maybe did not go so well that could use a little bit of improvement. If you look back at a lot of the work done by Gail Jensen and Catherine Shepard, Jan Guire, Lori Hack, a lot of the older work from like 1990 even till present focuses on expert versus novice clinicians. And one of the major things that you'll find in almost every expert clinician that a lot of the novices don't have is the practice of reflection. So it's super important to actually go and look back, if you can, on a day to day basis to see, what did I do today with certain patients? What went well with this patient? What didn't? What went well with the next patient? What didn't? Where should I maybe keep going with things and really lean into it because it seems to be working versus, oh, that didn't really work. Let's change that up and get rid of that and never do that again. It takes a little bit of trial and error for sure, but there's less and less of that as we see patterns and as those patterns develop over the years and we become expert clinicians. And again, one of the major factors in that is taking the time to sit and reflect on your day to day or your week to week, or even your whole year, right? If you like to think in bigger picture terms, and a lot of times you should, we look at a 1 year, 3 year, 5 year, 10 year goals, even. A lot of those have to kind of go through a process of looking back and seeing what I accomplished, what I did not accomplish, what I could do differently to maybe hit those goals, what I can do to speed up that timeline. Maybe I had it as a 3 year goal, but I could complete it in a 1 year goal if I focus in on this and this. So taking the time to actively reflect is going to be a super important thing to work on as you work towards becoming an expert and an authority in anything that you do. So consider reading some of those older seminal articles on expert clinicians and expert practice, especially in the world of orthopedics and outpatient physical therapy by Gail Jensen, Catherine Shepard, Jan Guire, Lori Hack. Like I said, any of the articles from about 1990 to present all do a really good job of figuring out how to establish expertise and authority, and a lot of it is through reflection. So keep that in mind. I hope that you will take the time in this new year to reflect on how last year went, and we will see you on the next episode. Well, I hope that episode was entertaining as much as it was informational and educational. If you enjoyed this episode or any of our past episodes, we ask you to please subscribe to the podcast and leave us a rating and review. And please share out the episodes to those who you feel may be able to benefit from them. We also urge you to follow us on all social media platforms at HET Podcast and let us know what topics or experts you would like to hear from in future episodes. And just as a reminder, none of the information on today's show should be considered medical advice. It's simply infotainment or edutainment to help educate our audience. For medical advice, we always advise you to reach out to your preferred medical professionals, and we'll see you on the next show.